For 19 years, Dr. Samuel Chen searched the world for a miracle. He consulted 89 specialists across 14 countries. He spent over $3 million. He read every medical journal, attended every conference, chased every experimental treatment. All for his daughter. All for Emma. Emma Chen was born blind. Not the kind of blindness that comes with age or injury, the kind you're born with. The kind that 70 specialists looked at and said the same 2 words. I'm sorry. But Dr. Chen wasn't just any father. He was one of the most respected neurosurgeons in the country, chief of neurosurgery at Johns Hopkins, published in every major medical journal. If anyone could find a cure, it would be him. Except he couldn't. And on a cold Tuesday morning in November, that all changed. Not because of another specialist, not because of some breakthrough research, but because of a 23-year-old nursing student on her very first clinical rotation. Her name was Maya Rodriguez, and she was about to see something that 89 experts had missed. Before we begin this journey, I need to know where you're watching from. Drop your country and city in the comments. This story is already changing lives around the world. Let's see how far it reaches. Now settle in, because what you're about to witness is the most extraordinary medical case of the 21st century. And it started with one simple question. Has anyone actually looked at her eyes? Emma Chen's world was sounds, textures, and temperatures. She knew her father's voice, deep, steady. The voice that read her bedtime stories in English and Mandarin. The voice that promised her every single night, "We'll find a way, Baobei, I promise." She knew her mother's perfume, jasmine and vanilla, the scent that meant safety, that meant home. She knew the feeling of Braille under her fingertips, the raised dots that opened worlds she couldn't see, books, stories, knowledge. Emma was brilliant. At 19, she had a 4.0 GPA. She'd been accepted to Princeton, full scholarship. She spoke 3 languages, played piano at a concert level, could navigate her family's house with her eyes closed, which of course they always were. She'd learned to be independent, to never ask for help, to prove to everyone, especially herself, that blindness was just an inconvenience, not a disability. But late at night, when the house was quiet, Emma would lie in her bed and wonder what her mother looked like. She'd felt her face 1,000 times, traced the lines of her cheeks, the shape of her nose, but she couldn't picture it, couldn't see it. Wonder what the sky looked like. People talked about sunsets, about stars, about the color blue. Emma had no reference, no concept. Those things didn't exist in her world. And wonder what she looked like. She'd never seen her own face, never seen her reflection. She existed in sounds and touch and darkness. Always darkness. Her father had never accepted it. From the day Emma was born, Dr. Samuel Chen had declared war on her blindness. The diagnosis was congenital optic nerve hypoplasia. In simple terms, Emma's optic nerves, the cables that connect the eyes to the brain, had never fully developed. Without those nerves, signals couldn't travel, images couldn't form. There was no cure, no treatment, no hope. That's what the first specialist said, and the second, and the 10th, and the 50th. But Samuel Chen hadn't become chief of neurosurgery at Johns Hopkins by accepting no. He'd spent 19 years consulting experts, flying Emma to clinics in Switzerland, Germany, Japan, South Korea. He'd investigated experimental gene therapy, stem cell treatments, retinal implants, neural interface technology. He'd read every study, every paper, every case report. He'd spent his entire career savings, mortgaged their house, worked double shifts, all searching for the one doctor who could do what 89 others couldn't:
fix his daughter's eyes.
The breakthrough came on the most ordinary day, November 15th, a Tuesday. Maya Rodriguez woke up at 5 a.m. in her tiny studio apartment in Baltimore. It was her first day of clinical rotations. She'd just finished her nursing fundamentals course at Baltimore Community College. 23 years old, first-generation college student. Her mother cleaned houses. Her father worked construction. Maya had been working 2 jobs while going to school: waitressing at night, retail on weekends, studying whenever she could find time. She'd wanted to be a nurse since she was 8 years old, since the day her abuela had a stroke and Maya watched the paramedics save her life. She wanted to do that, help people, make a difference. But she was terrified. Her clinical placement was at Johns Hopkins Hospital, one of the most prestigious medical centers in the world. She'd be working under real nurses, real doctors, people who'd been doing this for decades. What if she messed up? What if she wasn't good enough? What if she proved everyone right who'd said she should just get married and have kids instead of wasting money on school? Maya put on her scrubs, navy blue, brand new, still stiff, pinned her name badge to her chest. Maya Rodriguez, nursing student. She looked at herself in the mirror, took a deep breath. "You can do this," she whispered. "Just don't kill anyone on day 1. She grabbed her backpack. Inside, textbooks, notebooks, pens, her stethoscope, and a small photo of her abuela, for luck. Then she drove to Johns Hopkins, ready or not. Her supervisor was charge nurse Patricia Holbrook, 58 years old, 35 years of nursing experience. Patricia had a reputation. Tough, no nonsense. She'd made more than one nursing student cry and quit. "Rodriguez," Patricia said when Maya reported to the nurses' station, "You're late." Maya checked her watch. She was 3 minutes early. "Sorry, ma'am, I don't need excuses.
I need competence."
Can you provide that?" "Yes, ma'am." Patricia handed her a tablet. "Patient charts. You'll be shadowing me today. You don't touch anything without asking. You don't speak to patients without permission. You watch. You learn. You stay out of the way. Clear?" "Crystal clear, ma'am." "Good. Let's go." They made rounds. Patricia moved like a general inspecting troops. Fast, efficient, commenting on everything. "This IV needs changing. That catheter bag is too full. Chart that medication. Update that vitals board." Maya tried to keep up, tried to absorb everything, tried not to feel like she was drowning. Then they reached room 417. "This is Emma Chen," Patricia said, reading from the tablet. 19 years old, blind since birth. She's here for her annual checkup. Routine. Her father's Dr. Samuel Chen, chief of neurosurgery. So don't embarrass me." They entered the room. Emma was sitting on the examination table, black hair, pale skin, dark sunglasses covering her eyes. Her father stood beside her, tall, early 50s, gray streaks in his black hair, expensive suit, tired eyes, very tired eyes. "Good morning, Dr. Chen," Patricia said. Her voice changed, warmer, more respectful. "Good morning, Patricia," Dr. Chen said. "This is Emma's annual ophthalmology follow-up. Dr. Morrison should be here shortly." "Of course. Is there anything you need while you wait?" "We're fine, thank you." Patricia nodded, started to leave. Maya followed, but something made her stop. Emma was sitting perfectly still, hands folded in her lap, head slightly tilted, like she was listening to something far away. Maya had seen blind people before. Her uncle was blind, lost his sight in a car accident. But there was something about Emma, something about the way she held herself, like she was waiting. Always waiting. "Rodriguez," Patricia hissed from the hallway. "Move!" Maya hurried out, but she kept thinking about Emma, about those dark sunglasses, about the way Dr. Chen looked at his daughter, like he was memorizing her, like he was afraid she'd disappear. They continued rounds. More patients, more tasks, more of Patricia's corrections. But Maya's mind kept drifting back to room 417. During her lunch break, Maya did something she probably shouldn't have. She accessed Emma Chen's medical file on the hospital computer system. It was massive, hundreds of pages, consultations dating back 19 years, 89 different specialists, neuro-ophthalmologists, pediatric ophthalmologists, retinal specialists, optic nerve experts, from Johns Hopkins, Mayo Clinic, Cleveland Clinic, Moorfields Eye Hospital in London, Tokyo University Hospital, Bascom Palmer in Miami. Every single report said the same thing. Congenital optic nerve hypoplasia, bilateral, severe, irreversible. No treatment available. Maya scrolled through the imaging reports, MRIs, CT scans, OCT scans of the retinas. Everything documented, everything analyzed, everything concluded the same way. Emma Chen would be blind for life. Maya was about to close the file when something caught her eye. A note. Buried in a consultation report from 7 years ago. A specialist at Moorfields had written, "Mild bilateral epiretinal membranes noted on fundoscopic exam. Not clinically significant given primary pathology." Maya frowned. Epiretinal membranes. She just studied those last semester. They were thin layers of scar tissue that could form on the retina, usually in older people. They could cause vision problems, distortion, blurriness, but they were treatable, surgically removable. Why would a specialist note them and then dismiss them as not clinically significant? Maya kept scrolling, found 2 more mentions of retinal membranes. Both dismissed, both considered irrelevant given the optic nerve diagnosis. Something felt wrong. Maya pulled out her phone, Googled epiretinal membrane vision loss, pulled up medical articles. Read about how these membranes could block light from reaching the retina properly, how they could cause vision impairment, how surgery could restore vision if caught early enough. Then she Googled optic nerve hypoplasia misdiagnosis, found case studies, rare cases where patients diagnosed with optic nerve problems actually had other treatable conditions. Cases where the optic nerves looked underdeveloped on scans, but were actually functional, just obscured. Maya's heart started racing. What if everyone was wrong? What if Emma's optic nerves were fine? What if the problem was the membranes? What if 89 specialists had all made the same assumption? She looked at the clock. Her lunch break was over. She needed to get back. But she couldn't stop thinking about it. She found Patricia at the nurse's station. "Ma'am, can I ask you something?" Patricia didn't look up from her computer. "What?" "The patient in 417, Emma Chen. Has anyone ever—" "That case is above your pay grade, Rodriguez. Stay in your lane." "But I was reading her file and—" Patricia's head snapped up. "You were reading her file? Why?" "I just wanted to understand her condition, and I noticed something. She has epiretinal membranes in both eyes, and I was thinking—" "You were thinking?" Patricia's voice was ice. "You're a first-day nursing student. You don't think. You follow instructions." Dr. Chen has consulted with the best ophthalmologists in the world. They've reviewed every aspect of Emma's case. What makes you think you know something they don't? I don't. I just thought maybe... Stop, right now. You're here to learn, not to play doctor. Is that understood? Maya felt her face burn. Yes, ma'am. Good. Now get back to work. Maya spent the rest of her shift trying to focus, but she couldn't. The pieces kept turning over in her mind. Epiretinal membranes, dismissed as insignificant. But what if they weren't? What if everyone had been so focused on the optic nerve diagnosis that they'd missed something obvious? At the end of her shift, Maya walked past room 417. The door was open. Emma was alone. Dr. Chen had stepped out. Maya knew she shouldn't, knew it was against protocol, knew Patricia would destroy her if she found out. But she walked in anyway. Emma? Emma's head turned toward Maya's voice. Yes? Hi, my name is Maya. I'm a nursing student. I helped with your check-in this morning. I remember your voice. You were nervous. Maya smiled. Is it that obvious? You were breathing fast, and your shoes squeaked. New shoes squeak. You're very observant. You learn to be? Maya hesitated. Then, can I ask you something? About your eyes? Emma's expression didn't change. Sure. When did you last have a fundoscopic exam, where someone actually looked at your retinas with a light? Emma thought for a moment. I don't know. Years, maybe. Most of my exams are just imaging, scans. They don't usually use the lights anymore. They say there's no point. Would you mind if I looked? Just quickly? Why? I'm curious about something. It'll take 30 seconds. Emma shrugged. Okay, but my dad's going to be back soon. Maya pulled out her penlight, moved close to Emma. I'm going to take off your sunglasses, okay? Okay. Maya removed the sunglasses. Emma's eyes were beautiful, dark brown, clear, but unfocused. Maya clicked on the penlight. Look straight ahead if you can. Emma did. Maya shone the light into Emma's right eye, looked at the reflection, at the retina, and saw it. A thin, translucent layer, like plastic wrap, covering the entire retina. She moved to the left eye. Same thing. Both retinas had membranes, thick ones. Not mild, not insignificant, substantial. Maya's hands started shaking. Emma, can you see this light at all? I can tell when you turn it on and off. It gets brighter.
But I can't see the light itself.
Have you always been able to detect brightness changes? Yes, since I was little. But everyone said that was normal, that blind people can still sense light sometimes. Maya stepped back, put the sunglasses back on Emma. Her mind was racing. Thank you, Emma. Did you find something? Emma asked. Her voice was careful, hopeful. I don't know yet, Maya said honestly, but I'm going to find out. Maya left the room, walked directly to Patricia. I need to talk to Dr. Morrison, Emma's ophthalmologist. Patricia looked at her like she'd lost her mind. Absolutely not. I examined Emma's eyes. She has significant epiretinal membranes. They were noted in her chart but dismissed. I think... You examined a patient without supervision? Patricia stood up. That's a violation. You could be expelled from the program. I know, but this is important. Those membranes are blocking her vision. If they were removed... Rodriguez, stop. You're a student. You have no authority to make diagnoses or suggest treatments. Then let me talk to someone who does. Please. What if I'm right? You're not right. You're overstepping. And if you don't drop this right now, I'll have you removed from this hospital. Maya felt tears prick her eyes, but she didn't move. Then remove me, but at least let Dr. Morrison look at her eyes. Actually look, not just review scans. Please. Patricia stared at her, hard. You're willing to throw away your nursing career over a hunch? If it means Emma gets a second opinion, yes. Silence. Then Patricia picked up the phone. Fine, but when this goes nowhere, you're done here. Understood? Understood. Patricia called Dr. Morrison's office, explained the situation. There was a long pause. Then, he'll see you in his office. Now. Maya followed Patricia to the ophthalmology department. Dr. Richard Morrison was waiting. 60 years old, white coat, silver hair. He looked annoyed. You're the nursing student? Yes, sir.
Maya Rodriguez.
Patricia says you think you found something in Emma Chen's case. Something 89 specialists missed. His tone was skeptical, condescending. I'm not saying they missed it, sir. I'm saying it might have been dismissed too quickly. Explain? Maya took a breath. Emma has bilateral epiretinal membranes. They're documented in her file. But every specialist noted them as not clinically significant because they assumed the optic nerve hypoplasia was the primary problem. That's correct. The optic nerves are underdeveloped. Even if you remove the membranes, the nerves can't transmit signals. But what if the scans are wrong? What if the optic nerves look underdeveloped because the membranes are blocking the view? What if the membranes formed early, before the nerves could be properly assessed? Dr. Morrison frowned. That's highly speculative. But possible? Theoretically, but unlikely. Unlikely enough to not check? Maya pressed. Sir, Emma can detect light changes. That means some signal is getting through. If the optic nerves were completely non-functional, she wouldn't be able to do that. What if the membranes are the bottleneck? What if removing them restores function? Dr. Morrison was quiet for a long moment. Then, when did you graduate nursing school? I haven't. I'm in my clinical rotation. First day. His eyebrows went up. Your first day? Yes, sir. And you think you've identified something that specialists from Johns Hopkins, Mayo Clinic, and Moorfields missed? I'm not trying to be disrespectful. I just think maybe everyone was so focused on the optic nerve diagnosis that they stopped looking for other explanations. Dr. Morrison crossed his arms. You know what I think? I think you're a first-day student who doesn't understand how complex medical cases work. I think you're suffering from Dunning-Kruger effect, and I think you're wasting my time. Maya's face burned. Please, just examine her eyes. If I'm wrong, I'll leave and never bring it up again. You'll leave anyway, because Patricia's right. You violated protocol. You examined a patient without supervision. That's grounds for dismissal. I know, but before you dismiss me, just look at Emma's eyes, please. What do you have to lose? Dr. Morrison stared at her. Then, surprisingly, he sighed. Fine, but only because Dr. Chen is a colleague, and only because if I don't, you'll probably go to him directly and cause an even bigger scene. Thank you, sir. Don't thank me yet. They returned to room 417. Dr. Chen had returned. He looked surprised to see Dr. Morrison with Maya and Patricia. Richard, I thought Emma's appointment was tomorrow. It is, Dr. Morrison said, but this nursing student has raised some questions about Emma's case. I wanted to address them directly. Dr. Chen's expression hardened. What kind of questions? Maya stepped forward. Dr. Chen, I examined Emma's eyes earlier. I noticed significant epiretinal membranes. I know they've been documented before, but I think they might be more significant than previously thought. I believe they could be blocking her vision. Dr. Chen stared at her. You examined my daughter? Yes, sir. I'm sorry if I overstepped, but you're a nursing student. Yes, sir. And you think you found something that 89 ophthalmologists missed? I think it's possible they all made the same assumption, that they focused on the optic nerve diagnosis and didn't consider that the membranes could be the primary problem. Dr. Chen's jaw tightened. My daughter's case has been reviewed by the best medical minds in the world. Every possibility has been explored, every avenue investigated. And you, on your first day, think you know better? Dad, Emma said quietly. Everyone turned to her. Let her explain. Dr. Chen looked at his daughter, then back at Maya. Fine. Explain. Maya took a breath. Emma can detect light changes. That means some visual signal is reaching her brain. If her optic nerves were completely non-functional, that wouldn't be possible. But if the nerves are functional, and the problem is the membranes blocking light from reaching the retinas properly, then removing the membranes could restore vision. The scans show her optic nerves are underdeveloped, Dr. Chen said. What if the scans are inaccurate because the membranes are interfering with the imaging? What if they formed when Emma was an infant, before proper baseline scans could be done? That's speculation. Yes, sir, but it's testable. Dr. Morrison could examine Emma's retinas directly. If the membranes are as thick as I think they are, that's evidence they might be the primary problem. And if they are, surgery could help. Dr. Chen looked at Dr. Morrison. Richard? Dr. Morrison pulled out his ophthalmoscope. Let's find out. He moved to Emma. Emma, I'm going to look at your eyes, same as always. Okay. Dr. Morrison examined her right eye, then her left. His expression changed. He examined them again, longer this time. Then he stepped back. Well? Dr. Chen asked. Dr. Morrison's voice was very quiet. She's right. The room went silent. What? Dr. Chen whispered. Emma has bilateral epiretinal membranes, significant ones, grade 3, maybe grade 4. They're covering both macular regions, completely obscuring the retinal surface. We knew she had membranes. Every report mentioned them. We knew she had mild membranes. These aren't mild. These are severe. And I don't know how we missed them. The imaging should have shown this. Could they have gotten worse over time? Maya asked. Dr. Morrison nodded slowly. Possibly. Epiretinal membranes can progress. Maybe they were mild years ago and have thickened. Or maybe... He trailed off. Maybe what? Dr. Chen demanded. Maybe we saw what we expected to see. We had a diagnosis. Optic nerve hypoplasia. Everything else became secondary, insignificant. We stopped questioning. Dr. Chen sat down heavily, looked at his daughter. Are you saying Emma might be able to see if we remove the membranes? I'm saying it's possible. If her optic nerves are functional, and the light perception suggests they might be, then yes. Removing the membranes could restore some level of vision, maybe significant vision. How sure are you? I'm not. This is uncharted territory. But I think it's worth trying. Emma spoke. Her voice was shaking. What would the surgery involve? Dr. Morrison turned to her. It's called a vitrectomy with membrane peeling. We'd remove the vitreous gel from your eyes and carefully peel away the membranes. It's delicate. There are risks: infection, retinal detachment, bleeding. But the success rate for membrane removal is generally high. And if it works, you might see. I can't promise how much. It could be just light and shadow. It could be shapes. It could be more. There's no way to know until we try. Emma was quiet for a long moment. Then, how soon can we do it? Dr. Chen grabbed her hand. Baobei, you don't have to decide right now. We should get more opinions, research the risks. Gad, Emma's voice was firm. You've been looking for a cure for 19 years, and now someone's found a possibility. I'm not waiting for another 90 specialists to tell us it won't work. I want to try. Emma, please. She was crying now. Please let me try. Dr. Chen looked at his daughter, at the tears running down her cheeks from behind the dark sunglasses, at 19 years of hope and disappointment and resilience. Then he looked at Maya, at this 23-year-old nursing student who'd seen what no one else had. Okay, he whispered. Okay. Dr. Morrison nodded. I'll schedule the surgery for tomorrow morning. Emma, you'll need to fast after midnight tonight. We'll do pre-op blood work this afternoon. Your father can stay with you. He looked at Maya. You'll observe the surgery.
If you're going to start something this big,
you're going to see it through. Yes, sir, Maya said. Her voice was shaking. Thank you, sir. Patricia pulled Maya aside as they left the room. You just bet a blind girl's hope on a hunch. If this doesn't work, she'll be devastated. And it'll be your fault. Maya met her eyes. If it does work, she'll see for the first time in her life. That's worth the risk. Patricia studied her. Then, surprisingly, she smiled. Maybe you'll make a good nurse after all, Rodriguez. That night, Maya couldn't sleep. She kept running through every scenario. What if the surgery failed? What if she'd given Emma false hope? What if the optic nerves were damaged after all? What if she'd just destroyed a girl's life? She arrived at the hospital at 5 a.m., 2 hours before the surgery. Emma was already in pre-op. Dr. Chen was with her. Maya knocked on the door. Come in, Dr. Chen called. Maya entered. I just wanted to check on Emma, see if she needed anything. Emma smiled. I'm okay. Nervous, but okay. That's normal. Maya moved closer. Emma, I need you to know something. If this doesn't work, it's not your fault. And it's not a failure. We'll have tried. That's what matters. I know, Emma said, but I think it will work. Why? Because you believed in it, and I believe in you. Maya felt tears sting her eyes. I hope I'm right. Me too. Dr. Chen stood up, walked over to Maya, extended his hand. Thank you. Whatever happens today, thank you for caring enough to question. That's what good medicine looks like. Maya shook his hand. I hope I can give your daughter back to you, sir. You already have. You gave us hope. That's more than anyone else has done in 19 years. At 7 a.m., they wheeled Emma into surgery. Dr. Morrison led the surgical team. Maya observed from the gallery above. She'd never seen surgery before. It was both terrifying and beautiful. Dr. Morrison worked with microscopic precision, removing the vitreous gel, exposing the retinas, and then, carefully, delicately, peeling away the membranes. It took 3 hours. 3 hours of held breaths, 3 hours of watching Dr. Morrison work. Finally, he stepped back. Membranes removed, both eyes, retinas intact, no complications. Maya started crying. Up in the gallery, surrounded by medical students and residents she didn't know, she cried. Emma woke up in recovery an hour later. Her eyes were bandaged, would be for 24 hours. She'd have to keep her head positioned forward to help the eyes heal. She couldn't see yet, wouldn't know if it worked until tomorrow. "How do you feel?" Dr. Chen asked. He was holding her hand. "Scared," Emma whispered. "What if it didn't work?" "Then we're exactly where we were yesterday, no worse off. But maybe more hopeless." "Hope isn't something you lose, Baobei. It's something you choose, every day. And I choose to hope. Do you?" Emma thought for a moment, then nodded. "I choose to hope." 24 hours later, they removed the bandages. Emma was sitting up in bed, Dr. Chen on one side, Maya on the other. Dr. Morrison stood at the foot of the bed with his penlight. "Okay, Emma," he said, "I'm going to remove the bandages. Your eyes will be sensitive to light. It might hurt, and you might not see anything. That's okay. We'll know more in a few days as the swelling goes down." "I understand," Emma said. Her voice was steady, but her hands were shaking. Dr. Morrison carefully cut away the bandages, removed the gauze. Emma's eyes were closed, red, swollen. "Take your time," Dr. Morrison said. "Open them when you're ready." Emma took a deep breath. Then she opened her eyes and gasped. "Emma?" Dr. Chen's voice was frantic. "What's wrong?" "I see light," Emma whispered. "Actual light." Everyone froze. "You see light?" Dr. Morrison asked. "Yes, it's bright. It hurts. But I see it." "Can you see shapes? Movement?" I don't know. Everything's blurry."
But there's light.
"There's so much light." She turned her head toward her father. "Dad?" "I'm here." "Wave your hand." Dr. Chen waved his hand in front of Emma's face. Emma's eyes tracked the movement. "I see something moving. I can't tell what it is, but I see it moving." Dr. Chen made a sound, half laugh, half sob. He grabbed Emma's hands. "You see me. You're seeing me. I can't see you yet, but I will. Soon. I know I will." Dr. Morrison was grinning. "The swelling will go down. Your vision will get clearer. This is just the beginning, Emma." Emma turned her head toward Maya. "Maya? I'm here. Thank you. Thank you for seeing what no one else saw." Maya was crying too hard to speak. She just nodded. Over the next week, Emma's vision improved, dramatically. The blur resolved into shapes. The shapes resolved into objects. The objects resolved into faces. 7 days after surgery, Emma looked at her father and saw him clearly for the first time. "You're not what I expected," she said, smiling through tears. "No? You're more handsome, and you look younger than you sound." Dr. Chen laughed, cried, held his daughter. "What else do you see?" "Everything. The walls are white. Your coat is also white, but different white. And there are windows, with sky. Is that blue? Is that what blue looks like?" "Yes, Baobei, that's blue." Emma stared out the window for a long time. "It's beautiful. Everything is so beautiful." 2 weeks after surgery, Emma's vision had stabilized. She had 20/40 vision in her right eye, 20/60 in her left. Better than most people born with sight. She could read, drive, recognize faces, see colors, see the world. Dr. Morrison called it a miracle. Dr. Chen called it a gift. Emma called it a second birth. Maya was called into the hospital administrator's office. She thought she was being expelled. Instead, she was offered a full scholarship. "What you did was extraordinary," the administrator said. "You questioned. You persisted. You trusted your observation over established consensus. That's what we want in our healthcare providers." "I just looked at her eyes," Maya said. "No, you looked without assumptions. That's different, and that's rare." The story made national news. Nursing student cures blindness on first day. The headlines were dramatic, overstated, but the core was true. Maya had seen what others missed, and a life was changed. Emma returned to Princeton, started classes, saw her campus for the first time, saw her roommate, her professors, books on shelves instead of braille under her fingers. Dr. Chen established a scholarship in Maya's name for medical students who demonstrated diagnostic humility and patient advocacy. Maya graduated nursing school at the top of her class, was recruited by Johns Hopkins, became a nurse practitioner, specialized in ophthalmology. And every year, on November 15th, Maya and Emma had lunch together. To celebrate the day, everything changed. "Do you ever think about what would have happened if you hadn't questioned?" Emma asked during one of these lunches. They were at a cafe near the hospital, 5 years after the surgery. Maya thought about it. "All the time. And I think you would have lived a full life. You were already amazing, brilliant, independent. You would have been fine. But you would have missed seeing your mother's face, and your father's, and sunsets, and stars, and your own reflection." Emma smiled. "Thank you for being brave enough to speak up. Thank you for being brave enough to hope." 10 years after the surgery, Maya was giving a lecture at Johns Hopkins School of Nursing. The topic? The courage to question, when junior medical staff see what experts miss. The auditorium was full: students, residents, attending physicians, nurses. In the front row sat Emma Chen, now 29 years old, Harvard Medical School graduate, starting her residency in ophthalmology. Next to her sat Dr. Samuel Chen,
Retired now?
gray-haired, smiling. And next to him, Patricia Holbrook, still tough, still terrifying nursing students, but proud of what Maya had become. Maya told the story, the whole story, from the first day to the surgery to the recovery. Then she opened the floor for questions. A medical student raised his hand. "Dr. Rodriguez, what would you say to students who are afraid to speak up, who worry they'll be wrong?" Maya smiled. "I'll tell you what my mentor told me on my first day." She looked at Patricia. She said, "Don't think, follow instructions." And I ignored her. The audience laughed. Patricia rolled her eyes but smiled. "But here's the thing," Maya continued. "She was right. In most cases, follow the protocols. Trust the experience of those who came before you. But sometimes, rarely, but sometimes, you'll see something others missed. And when that happens, you have an obligation to speak up, even if you're scared, even if you might be wrong. Because the cost of being wrong is embarrassment. The cost of staying silent is a life unchanged." Another hand. "How did you know you were right?" "I didn't. I wasn't sure until the moment Emma opened her eyes and said she could see light. But I was sure enough to risk my career. And that's the calculus every medical professional has to make. Is what I'm seeing worth the risk of speaking up?" In Emma's case, the answer was yes. Emma raised her hand. "Dr. Rodriguez, I have a question." Maya grinned. "Yes, Dr. Chen? What color are my eyes?" The audience murmured, confused by the question, but Maya understood. "Brown, dark brown, beautiful." "I know," Emma said. "I check every morning, and every morning I'm grateful you looked at them when no one else would." There wasn't a dry eye in the auditorium. 20 years after the surgery, Maya received a call. "Dr. Rodriguez, this is Emma Chen." "Emma, hi, how are you?" I'm good. Really good. I wanted to tell you something. What's that? I'm getting married. Maya felt joy flood through her. Emma, that's wonderful. Who's the lucky person? His name is David. He's an artist, sculptor. We met at a gallery. I was there looking at paintings, which is still weird to say, and he was there displaying his work. We started talking. And, yeah, it's been 2 years. He proposed last week. I'm so happy for you. I want you to be there, at the wedding. And I want you to be my maid of honor. If that's okay? Maya's voice broke. It would be an honor. Thank you for everything, for giving me a life I never thought I'd have. You always had a full life, Emma. I know, but now I get to see it. That's your gift to me, and I'll never forget it. The wedding was in June. Outdoor ceremony, Emma wore white, looked radiant. During the reception, Emma gave a speech. There's someone here I need to thank, Emma said, looking at Maya. 20 years ago, I was blind. I'd been blind my whole life. Everyone told me I'd always be blind, that there was no cure, no hope. And then, a nursing student, on her very first day, looked at my eyes and saw something 89 specialists had missed. She risked her career to speak up. She gave me hope when I'd run out. And because of her, I'm standing here today, looking at all of you, seeing your faces, seeing my husband, seeing the world. Maya, I owe you my vision. But more than that, I owe you my gratitude for teaching me that sometimes the answer isn't in the experts or the textbooks. Sometimes it's in the courage to look again. Maya was crying. Again. Emma walked over, hugged her. Thank you for seeing me, Emma whispered. Thank you for letting me, Maya whispered back. 30 years after the surgery, Maya was retiring. She'd spent 3 decades as a nurse practitioner, had specialized in diagnostic ophthalmology, had identified dozens of misdiagnosed cases, had saved countless patients from unnecessary blindness. Johns Hopkins held a retirement ceremony. Maya sat on stage, uncomfortable with the attention. Emma stood at the podium, now 49 years old. Chief of ophthalmology at Massachusetts General Hospital, one of the top eye surgeons in the country. I'm here to talk about Dr. Maya Rodriguez, Emma said. But I'm not going to talk about her career, her achievements, the lives she's saved. I'm going to talk about one day, one moment, one decision. On November 15th, 30 years ago, Maya was a 23-year-old nursing student. She'd been working in a hospital for exactly 4 hours, and she saw something that would change my life forever. But here's what I want you to understand. Maya wasn't special because she was smart. Lots of people are smart. She wasn't special because she knew more than the experts. She didn't. She was special because she looked. Really looked. Not at scans, not at reports, not at 19 years of medical consensus. She looked at me, at my actual eyes, and she trusted what she saw. That's diagnostic humility. That's patient-centered care. That's good medicine. And that's what Maya has been teaching for 30 years. Emma paused, smiled. Maya once told me that the cost of being wrong is embarrassment. The cost of staying silent is a life unchanged. She was willing to risk embarrassment for the chance to change a life. And she did. She changed mine. So thank you, Maya, for looking, for questioning, for caring, for seeing me when I couldn't see myself. The auditorium stood, applauded. Maya stood too, walked to the podium, hugged Emma. You know what's funny? Maya said into the microphone. I spent 30 years trying to replicate that first day, trying to find another Emma, another missed diagnosis, another miracle. And I did find some, but nothing like that first one. Nothing like you. She looked at Emma. You taught me something that day too. You taught me that sometimes patients know. They know something's not right.
They know something's being missed.
And our job as medical professionals isn't to dismiss them, it's to listen, to look again, to question our assumptions. You trusted me, a first-day nursing student, to examine your eyes, and that trust changed both of our lives. Maya looked out at the audience, at the students, the residents, the attendings. So here's my advice as I leave this profession. Look at your patients. Really look. Don't just read the charts. Don't just trust the scans. Don't just accept what you're told. Use your eyes. Use your judgment. Use your courage. Because sometimes the answer is right in front of you. You just have to be willing to see it. 40 years after the surgery, Emma published a book. Seeing for the first time, a memoir of blindness, hope, and the nurse who changed everything. It became a bestseller. Medical schools used it as required reading. The book told Emma's story, from birth to blindness to surgery to recovery. But it wasn't really about Emma. It was about the importance of questioning, of humility, of patient advocacy, of the courage to speak up even when everyone thinks you're wrong. In the epilogue, Emma wrote, I lived blind for 19 years, but I wasn't truly blind. The medical system was. Blind to possibilities, blind to alternative explanations, blind to the idea that maybe, just maybe, everyone was wrong. It took a 23-year-old nursing student working her first day to open everyone's eyes, including mine. People ask me what it's like to see, what colors look like, what faces look like, and I tell them, sight is a gift, but it's not the gift I'm most grateful for. The gift I'm most grateful for is the gift of being seen, really seen, by someone who cared enough to look. That's what Maya gave me, and that's what I try to give my patients every day. I look, I question, I listen, I see them. Not their diagnosis, not their chart, them. That's what good medicine looks like, and I learned it from a nursing student who was brave enough to trust what she saw. Maya read the book, cried through most of it, sent Emma a text. You were always extraordinary. I just help people see it. Emma texted back, that's what you do. You help people see. 50 years after the surgery, Maya was 73 years old. Still sharp, still active, still teaching occasionally. Emma was 69, recently retired from Mass General, traveling the world with her husband. Still seeing, still grateful. They met for lunch on November 15th, their annual tradition. 50 years, Emma said, raising her glass of wine. Half a century since you changed my life. Maya raised her water. She'd stopped drinking years ago. Half a century since you let me. Do you ever regret it? Emma asked. Regret what? Speaking up, risking everything. You could have stayed quiet, finished your rotation, had a normal career. Maya thought about it. No, I don't regret it. That day taught me who I was, what I stood for. I became a nurse because I wanted to help people, and that day, I helped someone. Everything that came after was bonus. You helped hundreds of people, but you were the first, and you were the most important, because you taught me that questioning authority isn't disrespectful, it's essential. You taught me to trust my observations, and you taught me that sometimes the newest person in the room sees things the veterans miss. Not because they're smarter, but because they haven't learned what to ignore yet. Emma smiled. I still see your face when I close my eyes, you know. That first day, when you took off my sunglasses and looked at my eyes with your pen light. You looked so determined, so sure. I wasn't sure. I was terrified. But you looked anyway. Yeah, I looked anyway. 60 years after the surgery, Maya was 83 years old. Emma was 79. They still had lunch every November 15th. But this year was different.
Maya was in hospice.
Terminal cancer. Weeks left. Emma visited her every day. On November 15th, Emma brought lunch to Maya's room. "I brought your favorite," Emma said. "Chicken salad sandwiches." Maya smiled weakly. "You remembered." "I remember everything about that day." They ate in comfortable silence. Then Maya spoke. "Emma, can I ask you something?" "Anything." "Do you think it was worth it? The surgery? The recovery? The years of follow-up appointments? All of it." Emma looked shocked. "Of course it was worth it. Why would you ask that?" "Because I gave you something, but I also took something away." "What did you take?" "The identity you'd built. You were a blind woman who'd adapted, who'd thrived, who'd proven that blindness wasn't a limitation. And then I took that away. Made you sighted, changed who you were. I've always wondered if that was fair." Emma set down her sandwich, took Maya's hand. "You didn't take anything away. You added to what was already there. I was complete before. I'm still complete now, just differently complete. You gave me choice. That's what you gave me, the choice to see. And I chose yes. Every single day for 60 years, I've chosen yes. So thank you for giving me that choice." Maya smiled, squeezed Emma's hand. "I'm glad. Me too." They sat together, two old women, linked by a single moment 60 years ago. A moment that changed everything. A moment that proved that sometimes the answer is simpler than anyone thinks. Sometimes all you have to do is look. Really look. And trust what you see. Maya died 2 weeks later, surrounded by family, peaceful. Emma spoke at her funeral. "Maya Rodriguez saw me when I couldn't see myself. She questioned when everyone else accepted. She spoke up when staying silent would have been easier. She risked everything for a stranger, and because of that, I got to see my father's face, my mother's smile, my husband's eyes, my children's births, 60 years of sunrises and sunsets and stars, 60 years of colors and faces and beauty. All because one nursing student on her very first day was brave enough to look again. We should all be so brave. We should all look again, question again, trust our eyes and our instincts and our courage. That's how we change lives. That's how we honor Maya. Thank you, Maya, for seeing me, for believing in me, for giving me the world." And that's where we'll end this story. If this moved you the way it moved me, I need you to do something. Hit that like button. Not for me, for Maya. For every medical professional who's ever questioned consensus and saved a life because of it. Subscribe so you never miss stories like this. Because there are more Mayas out there, more people who looked when everyone else looked away, more quiet heroes who changed the world. Leave a comment. Tell me, have you ever questioned something everyone else accepted? Have you ever spoken up when it was scary? Have you ever been the Maya in someone else's life? Share your story. And most importantly, carry this lesson forward. Whether you're in medicine or not, whether you're a student or an expert, whether you're young or old, look at the world with fresh eyes, question assumptions, trust your observations, and speak up, even when it's terrifying, even when everyone tells you you're wrong, even when you might fail. Because the cost of being wrong is embarrassment, but the cost of staying silent is a life unchanged, and that's a cost too high to pay. Thank you for being here. Thank you for listening. And thank you to every Maya Rodriguez out there, every person who looked when others wouldn't, who questioned when others accepted, who spoke when others stayed silent. You're the real heroes, the quiet ones, the brave ones, the ones who change lives, one observation at a time. This story is for you. Now go out there and look again. Really look. You might just see what no one else can, and that might just change everything.